What if the biggest factor making your diabetes harder to manage isn't what you eat, how much you exercise, or even your medication dose, but something as basic as the timing and temperature of the water you drink during the day? It may sound surprising. You've likely spent years, maybe even decades, trying everything: different medications with side effects, strict diets that left you unsatisfied, costly glucose monitors, and supplements that promised results but delivered little. And now I'm saying that water, simple H2O, could be the missing link. Stay with me, because what I'm about to explain has helped many individuals achieve noticeable reductions in fasting blood sugar within just a few weeks. My name is Dr. Michael Kent, and today I'll show you how proper hydration strategies can improve how your cells respond to insulin, even if you've been living with diabetes for many years. These aren't just figures from studies. These are real individuals, people who come into appointments feeling tired, uncertain, and often discouraged. Many are in their mid-60s to late 70s. They follow every guideline. They check their glucose multiple times a day. They understand the glycemic index. They track carbohydrates carefully. They walk after meals, take medications like metformin consistently, and still, their morning readings remain unpredictable. You can see the fatigue in their eyes. Not just physical tiredness, although that is present, but a deeper sense of frustration. The kind that comes from managing a condition where the rules seem to shift constantly and progress feels out of reach. These individuals have given up foods they once enjoyed: pasta, bread, desserts. They've spent significant amounts on continuous glucose monitors, specialty foods, and supplements. They've attended every diabetes education program available to them. Yet despite all of this effort, their A1C levels continue to rise. What changed my perspective on diabetes management was recognizing a consistent pattern. A large number of adults over 65 are chronically dehydrated, and this dehydration triggers a chain of metabolic issues that make blood sugar control extremely difficult, regardless of medication. Here's what's interesting. Most research focuses heavily on diet. Very little attention is given to when and how people drink fluids. Before we go further, I'd like to know where you're watching from today. Share your location in the comments. Diabetes affects people worldwide, and it's encouraging to see a global community come together. Now, it's important to clarify something. This isn't about replacing your current treatment plan. Your medications are essential, and your doctor's guidance remains important. What I'm explaining is how to improve the internal conditions of your body so your treatments can work more effectively. Let's look at what's happening in the body that often goes unmentioned. As you reach your 60s, your body experiences 4 key changes that directly influence blood sugar regulation. First, your cellular water channels, known as aquaporins, become less responsive. Even when you drink enough water, your cells may struggle to absorb and use it effectively. Second, kidney function naturally declines. By around age 70, the kidneys can lose about 30% of their filtering ability. This reduces their capacity to remove excess glucose from the bloodstream and also affects how well they conserve water, often leading to increased fluid loss. Third, and this often surprises people, your sense of thirst becomes much less reliable. Research shows that by age 65, your body's thirst response can be delayed by up to 90 minutes after you actually need water. This means you could be dehydrated without feeling thirsty at all. Fourth, many commonly used diabetes medications, particularly diuretics prescribed for blood pressure, actually remove water from your body, which can worsen ongoing dehydration. Here's something most doctors don't clearly explain. When your cells become dehydrated, even by as little as 3%, their membranes start to stiffen. Think of it like a dry sponge compared to a wet one. A dry sponge can't absorb anything, while a moist sponge pulls in liquid quickly. Your cell membranes behave in a similar way. When they are well hydrated, insulin receptors work as they should. But when dehydration sets in, those receptors essentially stop responding. Your pancreas may still be producing insulin. You might even be taking insulin injections. However, if your cell membranes have become rigid due to dehydration, that insulin cannot function properly. As a result, glucose remains in your bloodstream instead of moving into your cells. This causes your blood sugar levels to rise, not because you ate the wrong foods or missed your medication, but because your cells are physically unable to take in the glucose that's trying to enter. Robert is 69 years old. His diabetes had been well controlled for 8 years. Then, suddenly, without any changes to his routine, his morning readings became unpredictable. He used to wake up with numbers around 110 to 120. Now, he was regularly seeing 170, 185, and sometimes even over 200. His daughter brought him in, concerned about the sudden shift. As I reviewed his glucose log with both of them, the pattern didn't make sense. Tuesday morning was 192, Wednesday 178, Thursday 201, Friday 186. His routine hadn't changed, same dinner each night, chicken breast, vegetables, and a small portion of brown rice. Same bedtime habits, same medication schedule. Yet his morning readings were highly inconsistent. Imagine his daughter leaning forward and saying, "He's doing everything exactly right, Dr. Kent." I help him prepare his meals. We measure everything carefully. Something is clearly off. So, I began going through his daily routine step by step, hour by hour. What time he wakes up, what he eats, when he takes his medications. On paper, everything appears perfectly aligned. Then I shift the conversation. "Robert, walk me through your fluid intake during a typical day." This is where the pattern starts to show. "Well, I have my coffee when I wake up, maybe a glass of water with my pills at breakfast, another glass at dinner, and sometimes iced tea in the afternoon." When I ask specifically about plain water, he admits maybe 2 glasses in total. I'm never really thirsty, so I don't think about it. Here's the issue. At 185 pounds, Robert needs roughly 90 ounces of water each day. He's taking in maybe 16 ounces. He's chronically dehydrated, yet his reduced thirst response gives him no clear warning. And coffee is a diuretic. For every 8 ounces of coffee, you only retain about 3 ounces of actual hydration. The rest is drawn from your body's existing water reserves. We introduce what I call the WTR protocol, which I'll explain fully in a moment. Essentially, we restructure when, how, and at what temperature he drinks water. 10 days later, Robert reaches out. His tone is completely different, lighter, almost enthusiastic. "Dr. Kent, my morning reading was 118 today. Yesterday, it was 124. 3 days ago, 132. I haven't seen numbers like these in 6 months. For weeks later, the change is visible. Better energy, improved complexion. His glucose log shows an average fasting reading of 127 for 2 straight weeks, down from 185. Same meals, same medications. The only variable that changed was strategic hydration. But here's what he shares that really confirms it. "I feel different, Dr. Kent. It's hard to explain, less foggy, more aware. Like there was this constant mental haze I had gotten used to, and now it's gone." That mental clarity, that's what happens when your brain, which is 75% water, finally becomes properly hydrated after months or even years of being depleted. The specifics may vary, but the core issue is almost always the same. Before I show you the exact protocol that works in cases like Robert's, let me explain the 3 critical mistakes nearly everyone makes with hydration after age 60. You're likely making at least 2 of these right now. Mistake number 1, counting coffee, tea, and other drinks as water. Here's the truth. Coffee and tea are mild diuretics. For every cup you consume, you lose about 60% of that volume through increased urination. So, if you drink 8 ounces of coffee, you retain only about 3 ounces of real hydration. The rest is taken from your body's existing water stores. Juice, even without added sugar, can cause rapid blood sugar spikes that prompt your kidneys to flush out both glucose and water. Diet sodas contain artificial sweeteners that can actually worsen insulin resistance. The only drink that truly hydrates is plain water. Everything else is supportive at best, harmful at worst. Think of it this way. If you have a checking account that requires $1,000 to avoid overdraft fees, would you deposit $1,000 knowing the bank immediately withdraws $600? You'd still fall short. That's exactly what coffee and tea do to your hydration levels. Mistake number 2, drinking cold water straight from the refrigerator, especially first thing in the morning. This may surprise you because cold water feels refreshing, but here's what happens physiologically. When ice-cold water enters your stomach, especially when your core body temperature is still low after sleep, your blood vessels quickly constrict. This is your body trying to preserve its core temperature. When blood vessels constrict, circulation drops significantly. And where does glucose need to go? Into your cells, through your bloodstream. Constricted blood vessels mean insulin and glucose cannot reach their destinations effectively. In addition, cold water on an empty stomach shocks your digestive system. This triggers a stress response that releases cortisol. And what does cortisol do? It signals your liver to release stored glucose into your bloodstream. You have just caused a morning blood sugar spike before even eating breakfast. Room temperature water, or even better, warm water, helps keep your blood vessels relaxed and open. Circulation stays optimal. Your stress response remains controlled. Your morning blood sugar stays stable. Mistake number 3, drinking large amounts only when you finally feel thirsty. Remember, your thirst mechanism is weaker. By the time you feel thirsty at age 65 or older, you are already significantly dehydrated. But what do most people do next? They drink 16 or 20 ounces all at once, thinking they are solving the problem. Your intestines can only absorb about 8 ounces of water every 20 minutes. Anything beyond that simply moves to your bladder and is quickly eliminated. You have not hydrated your cells. You have just made an unnecessary trip to the bathroom. It is like trying to water a garden with a fire hose. The soil cannot absorb it fast enough. It runs off. The roots remain dry even though you used a lot of water. Proper hydration requires small, frequent amounts throughout the day. Think of it as maintaining a steady light rain instead of one heavy downpour. Now, let me explain the exact protocol I use with my patients. I call it the WTR protocol. W stands for water itself, clean and intentional. T stands for timing, the specific schedule that supports glucose control. R stands for regulation, how your body learns to predict and respond. Let us break down each part. First, water quality matters more than many people think. Tap water is acceptable if your local system has good filtration, but I recommend filtered water when possible. Not because of extreme toxins, but because minerals are important. Here is my specific suggestion. Use filtered water and add trace minerals back in. You can buy liquid trace mineral drops at most health food stores, usually for about $10, and they last for months. Why minerals? Your cells need more than just H2O. They require electrolytes to create the electrical gradients that allow glucose to enter. Think of minerals as keys that unlock your cell doors. Water without minerals is like arriving at a locked door without a key. Specifically, magnesium is essential for insulin function. Nearly 70% of people over 60 are clinically deficient. Potassium helps regulate glucose levels. Sodium, in proper amounts, is necessary for cellular hydration. My recommendation: add 5 drops of trace mineral solution to every 32 ounces of water you drink. That is it. Simple, affordable, and highly effective. Window number 1. Immediately after waking, before anything else, the moment your feet touch the floor, before coffee, before the bathroom, before checking your phone, drink 12 ounces of room temperature water with minerals. Room temperature, not cold, with minerals, not plain. This produces a powerful effect. After 7 to 8 hours without fluids, your blood has actually thickened overnight. Your first drink of the day rehydrates your blood, helping it flow more easily and deliver insulin more efficiently. In addition, drinking water first thing signals your hypothalamus to gently activate your metabolism. This helps prevent the cortisol spike that leads to the dawn phenomenon, that frustrating morning blood sugar rise that seems to appear unexpectedly. In cases like Robert's that I mentioned earlier, this single step often reduces morning glucose by 30 to 35 points on average. 35 points from 12 ounces of water at the right time. Window number 2, 30 minutes before each meal. This timing is very important. Drink 8 ounces exactly 30 minutes before breakfast, lunch, and dinner. Not 15 minutes, not immediately before eating. 30 minutes. Why? This gives your stomach time to prepare. It activates digestive enzymes. It starts to adjust stomach acid to the optimal level for breaking down food. Most importantly for blood sugar, it slows gastric emptying. When food moves more slowly from your stomach to your small intestine, carbohydrates are absorbed more gradually. This creates a steady rise in blood sugar instead of a sharp spike. Your available insulin can keep up with the incoming glucose. Studies show this single habit can reduce post-meal glucose spikes by up to 35%. That's comparable to the results of certain medications, achieved simply by drinking water at the right time. Window number 3, mid-morning and mid-afternoon, between meals. This is when many people's blood sugar behaves unpredictably. You're not eating, so you expect your glucose to stay steady, but then you check and see it has increased by 20 or 30 points without a clear reason. What's really going on? Dehydration. As your blood loses water through normal metabolic activity, it becomes more concentrated. More concentrated blood leads to higher glucose readings, even though no additional glucose has been introduced into your system. Drink 6 to 8 ounces at 10:30 a.m. and again at 3:30 p.m. small amounts. Precise timing. This helps maintain consistent blood volume and keeps your glucose level stable. Window number 4. 2 hours after your final meal of the day. This one often surprises people. Most have heard that drinking water right before bed should be avoided because it can lead to nighttime bathroom trips. And that's correct. Drinking at 10 p.m. and going to bed at 10:30 p.m. will likely wake you around 1 a.m. to use the bathroom. However, drinking at 7 p.m. or 8 p.m., a full 2 to 3 hours before bedtime, gives your body enough time to process and distribute the water. You will probably urinate once before bed and then sleep through the night. This evening hydration plays an important role in fasting blood sugar. It prevents your blood from becoming too thick overnight, helping you wake up with better circulation and more stable morning readings. Here's what many people don't realize. Your body adapts to patterns. If you have been chronically dehydrated for months or even years, your body adjusts to operate in a low water state. Your kidneys concentrate urine more, your brain reduces thirst signals, and your cells accept less fluid. When you suddenly begin drinking more water, your body initially reacts by sending you to the bathroom more often. This is normal and temporary. It doesn't mean you are hydrating incorrectly. Your body is simply recalibrating. Most people give up after 3 days because the frequent bathroom trips are inconvenient. But here's what happens if you continue. Within 10 to 14 days, your kidneys adapt. Your bladder becomes more comfortable holding fluid. Your cells start absorbing more water. The urgency to use the bathroom decreases significantly, while true hydration at the cellular level improves. This is the adjustment phase. You are training your body to recognize that water is consistently available, so it no longer needs to remain in a stress state. In addition, drinking water on a structured schedule helps regulate your circadian rhythm. Your body begins to expect these hydration windows and prepares your metabolism accordingly. Over time, this leads to more stable blood sugar patterns. So, what happens when you follow the WTR protocol? Let's set realistic expectations week by week. Week 1, you will likely visit the bathroom more often than usual. There's no point in avoiding this fact. It can be inconvenient, but it is temporary. Your body is clearing out accumulated metabolic waste. Stay consistent through this week. In terms of blood sugar, you may notice small improvements, around 5 to 10 points lower on average. Nothing major yet. Some people feel slightly more energetic, while others notice little change beyond increased bathroom visits. Week 2, bathroom frequency begins to return to normal. Most people report that by day 10 or 11, they are no longer constantly searching for restrooms. Blood sugar readings start becoming more consistent. They may not always be lower, but the random fluctuations decrease. The gap between your highest and lowest readings each day starts to narrow. Week 3, this is when many people experience a noticeable shift. Morning fasting glucose begins to drop, often 15, 20, or even 25 points below previous averages. Post-meal spikes become more predictable and less intense. Most importantly, you start to feel a difference. Mental clarity improves. The afternoon energy slump becomes less severe. Some people also report reduced joint discomfort, likely due to lower inflammation when hydration improves. Week 4 and beyond, blood sugar control continues to improve. Many individuals see their A1C decrease by 0.5 to 0.8 points over 3 months. Under medical supervision, some are able to reduce their medication dosage. Typical feedback at the 12-week point sounds like this: I haven't had a single reading above 160 in 3 weeks. Before following this protocol, I was above 180 almost every day. My doctor reduced my evening metformin dose by half. Linda is 73. Linda had been living with type 2 diabetes for 16 years. When she first came in, she looked clearly discouraged. Imagine her sitting across from me saying, "Dr. Kent, I need you to be completely honest with me. My endocrinologist says I need to begin insulin, My A1C is 8.9, up from 7.8 just 6 months ago. I'm already taking 3 oral medications. I honestly feel like I'm failing. She pauses, and you can see tears starting to form. I'm terrified of needles. I know it may sound silly at my age, but the idea of injecting myself several times a day, I don't know if I can handle that. Her total daily water intake is around 20 ounces, if that. Her urine appears dark amber. Her skin shows that dry, papery texture linked to long-term dehydration. She reports constant fatigue. When I explain the WTR protocol, she reacts with doubt. Water? Really? That feels too simple to make any real difference. Still, she is willing to try anything to avoid insulin injections. So, we begin immediately. The first week is difficult. She messages me on day 4. I feel like I'm living in my bathroom, but I encourage her to continue. By week 2, things begin to improve. Bathroom visits are finally decreasing. I actually slept through the entire night for the first time in months, and my morning blood sugar was 148 yesterday. It hasn't been below 175 in half a year. By week 3, she returns for a follow-up. The difference is noticeable: healthier skin tone, brighter eyes, easier movement. Look at this, she says, showing her glucose log. My average fasting reading this week was 139. My post-meal numbers rarely go above 165. Before this, I would regularly reach 220 or 230 after eating. We check her A1C again at 3 months. It drops from 8.9 to 7.7. Still not ideal, but a significant improvement. Her endocrinologist even calls me. I don't know what you did, but keep doing it. We're holding off on insulin. If her next A1C continues this pattern, we may even reduce one of her oral medications. But here's what Linda says that truly captures the point. I realized I had spent 16 years carefully managing my diet, my exercise, my medications, everything except the most basic thing my body needs: water. I was running on empty and expecting my body to perform perfectly. 6 months later, her A1C is 7.2. The discussion about insulin is no longer necessary. She avoided the injections she had feared through hydration, timing, and consistency. Sometimes, the most basic needs are the ones overlooked while focus stays on more complex solutions. Now, let me be very clear about important precautions. This protocol is not a cure for diabetes. It will not replace your medications. Never stop taking prescribed medication without direct approval from your doctor. What this protocol does is support your cellular environment so medications can work more effectively and your body's natural insulin response can improve. There are also key considerations. If you have congestive heart failure or any condition where fluid retention is a concern, speak with your cardiologist before increasing water intake. In certain heart conditions, too much water can worsen fluid retention. If you have kidney disease, especially if you're on dialysis or have less than 30% kidney function, you need personalized guidance. Do not increase water intake without your nephrologist's approval. If you are taking diuretic medications for blood pressure or heart conditions, your doctor may need to adjust your dosage as your hydration improves. Proper hydration can naturally lower blood pressure, which is beneficial, but it may make your current diuretic dose too strong. Also watch for signs of overhydration, although this is uncommon. If you are urinating completely clear urine more than 10 times a day, or if you experience headaches or nausea, you may be drinking too much water. Reduce your intake slightly, and please share your experience in the comments. Tell me where you're starting from. Let me know what you notice after week 1, week 2, and week 3. Your story could be exactly what someone else needs to hear to give this a try. If you made it all the way to the end of this video, type "I finished the video" in the comments below. It helps me know this information is reaching people who truly need it, and it also helps YouTube share this with more individuals managing blood sugar challenges. Then tell me, are you ready to try the WTR protocol? What concerns do you have about starting it? I read every comment, and I will respond to your questions. If you found this video helpful, please share it with someone managing diabetes, a parent, friend, or spouse who is struggling despite doing everything right. This simple approach could truly make a difference in their life. And if you haven't subscribed yet, click the subscribe button and turn on the notification bell. I post new videos every week on managing diabetes, improving metabolic health, and living well after 60. Thank you for being here. Thank you for taking your health seriously enough to watch a 16-minute video about something as simple as drinking water. Remember, sometimes the most effective solutions are not the most complex. Often, it's getting the basics right that leads to real change. Take care of yourself. This is Dr. Michael Kent, and I'll see you in the next video.